Hello and welcome. We are in conversation with Dr. David Legge from the People's Health Movement, and he teaches public health in La Trobe University, Australia. And we will be talking about the World Health Organization, which has been a subject of a lot of debate and controversy in the recent years. So David, first of all, thank you very much for being with us. And if we may start with my asking you, what is the crisis that the WHO today is facing? Because a lot of people have said that the WHO is becoming less and less relevant, and its stewardship of global governance of health is something that is on a downslide.
Well, of course, the crisis is a crisis in global health, not just a crisis in WHO. There's 1 billion people who don't have access to healthcare, who are living in circumstances which make their health very hard to maintain, and the question is, what is WHO doing about it? And the problem is that over the last 10, 15, 20 years, WHO has been progressively weakened through several means, one of which is the growing number of special purpose donor bodies like the Global Fund for AIDS, Tuberculosis and Malaria, which have progressively reduced the scope of WHO.
But a lot of people have argued that that's actually brought in more money into public health and healthcare, which wasn't there earlier.
Well, indeed it has, and the reason for that is that the big donors are suspicious of WHO and were unwilling to give it money, but were willing to give money to more pliant donor organisations. But the question is whether, in fact, what we need is for WHO to take a leadership on some of those issues. Now, if I could just give one example, and that's the question of trade and health. Trade is a very important determinant of health, and WHO has been pushed into taking a more active role in trade over the last several years, particularly since the resolution was adopted in the World Health Assembly in 2006. But there are big countries who don't like, and the World Bank doesn't like, the World Trade Organization doesn't like WHO being involved in those things.
But what is the reason for this kind of mistrust of WHO that big countries and certain agencies have?
It's very simple. It's the fact that WHO has got one country, one vote. And so the kind of resolutions which are adopted at the World Health Assembly reflect to a much greater degree than, for example, at the World Bank, reflect the concerns of many, many smaller countries. So what's been happening over the last several years is that the WHO budget has depended more and more on earmarked funding which is tied to specific purposes, which from the point of view of the donors often are safe purposes, in order to prevent money being freely available to the Secretariat.
So where's the main money for WHO coming from today?
82% of WHO's budget comes from donors, that's to say G6 countries and the World Bank and other large donor organisations who are paying for quite specific work to be done. 18% of WHO's revenue comes from untied country payments in terms of their payment as members of WHO.
For example, the World Health Assembly discusses something. They're just discussing 18% of the organization's program?
It's much worse than that. It is certainly true that when a resolution is passed at the World Health Assembly, it may well be there is no money for it. No, for example, WHO's had a number of resolutions about the rational use of drugs, putting in place disciplines to prevent overuse of drugs for two reasons. One is it's expensive and it's a waste, and the other is that, particularly in terms of antibiotics, it's going to create resistance. But the big pharma is not terribly interested in supporting rational use of drugs. They're interested in promoting wider prescription of drugs, and the big countries who are hosts to big pharma like US, Switzerland, Germany, Japan, likewise don't have an incentive to fund proper regulation of the prescription drug industry.
And there has also been the charge against WHO of conflict of interest, because pharma has been involved in some ways in either funding or in being part of different committees that the WHO sets up. Now, how far has that gone? Is that a real concern for the WHO today?
It's conflict of interest, it's not corruption. There may be some corruption, but I don't think the big issue is corruption. I think the big issue is that WHO leans backwards to avoid offending its donors. And it has leaned backwards to avoid offending, for example, the International Atomic Energy Agency, which has taken a very positive approach to the dangers of nuclear accidents. They say that only a few hundred people died from Chernobyl, denying the possibility that over the succeeding decades, actually a huge number of people could well get a higher incidence of cancers. The problem, of course, is in those regions there's no proper cancer registries, and so the data are not very clear. But the consequence of this sort of sensitivity of WHO has been a backpedaling on some important issues.
Say about 3 decades back, WHO was the main organization in terms of stewardship of global health. Which are the organizations which have now taken up a larger role in global health governance, and WHO has gone into the background?
Well, it depends on how you construct global health governance. If you take a narrow view, then you would say that the World Bank is the dominant, or the USAID and the World Bank, or the USAID and the OECD in Paris, and DFID are the main governing bodies, plus in addition to WHO. But if you include in your construction of global health governance the dispersal of health-related aid, then there's at least another 100 new bodies been established over the last 10 years, like the Global Fund for AIDS, Tuberculosis and Malaria, Gavi, the Global Alliance
Vaccines.
for Vaccine Initiative, and immunisation. There's another, and many of these organisations are really quite narrow in their function. But I think that...
And the Gates Foundation?
I'm sorry, and the Gates Foundation. But when you talk...
How important do you think the Gates Foundation today is in global health?
Well, I think the Gates Foundation is very important in terms of giving money. It's a major source for the Global Fund. It's also very important in determining what is acceptable and what's not. More as a metaphor or a window into the way the system works. So you see, in the mid-1990s, when effective drugs for the first time for AIDS, HIV came on board, there was a very strong grassroots movement globally for changing the intellectual property laws globally to make it easier for people who are sick to get access to medicines. In particular through things like compulsory licensing, like that, which means governments insisting on a particular drug being made without waiting for the permission of the owner of the patent. And the drug companies were very worried at that time, and at that point an alternative model, so there's 2 models. One is the model of charity, which is where the big countries and big donors give money to buy drugs.
And that's the one that the Gates Foundation is.
And the Gates Foundation likes that one. The alternative was to change the very tight intellectual property restrictions on the availability of drugs, which is what many people in the Third World were looking for. So the fact that the Gates Foundation, this is a very important connection, I think, the fact that the Gates Foundation has put so much work into building the Global Fund, which affirms a charity model for giving drugs to poor countries, is not unrelated to the fact that the United States is the world's biggest intellectual property exporter. The United States exports 3 times as much intellectual property as it imports. The next closest country is Japan, which exports 40% more. Every other country after that are net importers of intellectual property. That's a measure of payments of royalties and licence fees. It's not a measure of the profits which arise from monopoly pricing. So the US economy, as well as the profitability of the big drug companies, actually depends upon this.
So what you're basically saying is the Gates Foundation is also, in a sense, working for the interest of the US economy and US corporations.
In particular, it's working for the interests of tight intellectual property, which of course is exactly where Gates got his money from in terms of Microsoft.
In the last World Health Assembly, Margaret Chan proposed that the WHO is in a crisis, in a financial crisis, and she talked about the 2080 crisis, that 20% of WHO funding is actually assessed funding that's coming from the member countries, and 80% is earmarked for particular programs. Now, this is a shift from even, say, a decade back, where 60% or more of WHO's funding was actually coming from the countries. Now, how do you see the future in terms of whether this can be changed? What are the other ways in which the WHO can be financed so that it does not fall into the conflict of interest trap?
It really depends upon whether the constituency which cares about WHO is strong enough to insist on adequate funding. And that's going to be a matter of an organised expression from developing countries and a strong expression of civil society opinion in the north, in the G6, G8 countries. If there was strong enough pressure on the countries of the north to provide their donations in untied, unearmarked funding, the WHO would be infinitely more effective. And the dysfunction which characterises the administration of the organisation is not only due to that, but it's a major cause of that dysfunction. That would be resolved.
Thank you. Thank you, David, for talking to us.
My pleasure, Amy.